Hi, everyone. Thank you for joining today and for watching our Stop Shingles webinar. Today, we're going to be talking about our current shingles campaign, which focuses on protecting patients from shingles. The webinar is being recorded and sent out on Wednesday, February 12th, but do feel free to watch it at any time that works for you. We are hosting our shingles campaign throughout all of February 2020, but again, we know that immunizations is an ongoing thing, especially in adults, so do feel free to keep materials up or continue to actively seek out patients throughout the year. My name is Tiana, and I'm the Director of Pharmacy Innovation and Professional Affairs at Whole Health, and I'm joined here with James Morrison.
Hello.
And together we will be walking you through our Stop Shingles webinar. So we first wanted to mention that certain components of the Shingles initiative are sponsored by GSK. And this is specific components, and they have been indicated on them with a line about the GSK sponsorship so that you know exactly which materials come from their medical education grant. So today we'll go over shingles as well as how to protect your patients largely through immunization. We'll then talk about how to integrate adult immunization into the busy pharmacy workflow. And we'll lastly talk about the shingles program, so the campaign materials that you've been sent out. So many of you know that Whole Health has a strong adult immunization program. It started back in 2017 with our World Pneumonia Day, or Did You Know Pneumonia campaign. This then grew to include our Meningitis Minute campaign. And finally, this year, we're adding our shingles campaign. And so that was based on a lot of feedback from the pharmacists and pharmacy team members who said that shingles is actually an area that a lot of patients and clients are really interested in being immunized against. And so the pharmacists were looking for materials to help both advertise this and respond to patient questions. So based on your feedback, we developed this program. We're always open to more programs, so let us know if there's another adult immunization that you'd like us to focus on, and we will do our best to incorporate it in future years. We also wanted to touch on the great successes that we've had with the adult immunization program. So looking at immunizations from 2018, we found that rates of pneumonia vaccines, for example, increased by more than 171% compared to the prior 2017 year. And so that can largely be attributed to the adult immunization programs that we ran in the pharmacies. And then when we look at even more recent years, so in 2019, we increased adult immunization against pneumonia for patients by another 89% across the banner. So it looks like these programs really are working and are helping pharmacies differentiate themselves, dispense more vaccines, and ultimately protect more of their patients.
Those are really great numbers, Tiana. Very impressive. And you know, there are some stores in the banner still not contributing, so it's a really great opportunity to even, push that through the roof this year.
I agree. So now we'll talk about shingles. A lot of patients might come to you with questions about shingles, and I think part of this can be attributed to the great amount of attention that shingles is getting in the media. So some of you may have seen the Shingles Doesn't Care campaign, the Shingles Can Be What campaign, or even some of the campaign spokespeople, like the football legend Terry Bradshaw, who speaks about his experience with shingles. So what is shingles? Well, we know that shingles, or herpes zoster virus, is actually the same virus that causes chickenpox, so varicella zoster virus, that has then stayed dormant in the dorsal root ganglion of patients until such point as their immune system may become a bit weaker. That could be due to age or other immunocompromising conditions, and then it resurfaces as shingles.
This is a very important slide to understand how we come to have shingles, and there's a lot of misconceptions among the public about that. A lot of people will come in and say, well, I never had chickenpox, so I don't need that vaccine. But there's a lot of asymptomatic chickenpox, or perhaps they don't remember or their parents forgot to tell them that they did have shingles or chickenpox as a child. So they do have that shingles risk nowadays still. So it's a really important conversation to have at the pharmacy.
Yeah. One question that a lot of pharmacies actually end up getting is patients who have had the chickenpox vaccine, should they be immunized and what's their risk? And just to address this right now, we don't actually know yet because the varicella zoster virus vaccine was introduced quite recently in the grand scheme of things. We don't yet have data from patients who have now aged and are at the age point where shingles is more prevalent. So we'll continue to monitor over the years and see if there's protection or there's risk. We'll have to find out. So shingles in Canada is quite common.
Yeah, so if we look at the whole population, statistically, 1 in 3 of Canadians will get shingles in their lifespan. But when we look at the more elderly patient population, so in our senior group, it's roughly 1 in 2 will have a shingles outbreak by the age of 85. So it becomes more prevalent as we age.
Yeah, and a lot of people think of shingles as almost a benign rash, but what many might not realize is how debilitating and severe shingles can really be. So when we look at shingles complications, we know that postherpetic neuralgia is quite common. About 10% to 18% of people who get shingles actually do get this long-term pain, and this pain can actually last for months to even years and be quite debilitating. In addition to that, people who get shingles in the eye region can actually end up with vision loss and complete impairment of vision.
Yeah. Scarring mentioned on the slide is something I've seen quite a lot in the community. In particular, I've seen a number of shingles cases on the face, which can be scarring, especially if you let that get exposed to the light. So it's good advice. I have one lady who was very grateful that I advised her to get a big hat and wear that because it was summer, and it would have caused even worsening scarring if she was to expose that to the sun. And I have seen a number of infected shingles cases. Unfortunately, patients may not recognize they have shingles at the beginning, which leads them to a lot of scratching and opening up those lesions, and then they develop infection.
So when they do realize that it is shingles, and I think pharmacists can play a large role in helping to identify this, and we'll talk about the signs and symptoms in the next slide, covering it up is very important. So some of the home health care items you might have in your pharmacy can be used for this, both to prevent things like scarring and infection, as well as to prevent transmission. So some of the, I would say, more telltale signs and symptoms of shingles include an itching or burning sensation. That can be a bit prodromal, and then in a few days, the patient might notice a single strip rash, so something that's along a dermatome and on one side. Some very common areas for this would be the torso, the shoulder, and the face, but that's not to say that it couldn't be on other areas or dermatomes of the body as well.
If you see shingles cases in your practice, what Tiana mentioned on one side is very important. You'll often see it like starting in the mid-back and wrapping its way around the front as it progresses. So always unilateral if you're trying to assess whether that's shingles or not you're looking at.
And in the earlier days of shingles on that specific patient, once the rash erupts, it might become blistering and kind of oozing vesicles. And then after that, it'll crust over. The patients might experience pain, tingling, and numbness all along that same region as well. And then some of the signs and symptoms are a bit more non-discriminate, things like fevers and chills, headaches or tiredness, upset stomach, and feeling unwell. So those might be signs and symptoms that something is up, but the top line of signs and symptoms here really indicate that shingles should be considered in the differential diagnosis. One of the other things that can help the pharmacist identify these signs and symptoms as shingles is it in the patient population who's at risk? And that's not to say that other patients can't get shingles. We've actually heard of a lot of cases of people even in their 30s and 40s getting shingles. But when we look at who's most at risk, we have adults 50 years and above, people who have that known history of chickenpox, and then individuals who are immunocompromised either due to medical conditions, so things like cancer or HIV, or immunocompromising medications, so some things like biologics or medications for rheumatoid arthritis.
Right, and that's a good opportunity for pharmacy. If you have a patient and you know that they're going to be starting an immune suppressing medication in the future, near future, you might want to screen them now to see if you can get that shingles vaccination updated prior to starting an immune suppressing medication, just to lower their risk of developing shingles.
So now that we know who the patients are and what shingles is, what is the pharmacist's role in protecting your patients? Well, we know that in Ontario and in Alberta, if the pharmacist is injection certified and they have a valid standard first aid and CPR, that they can actually administer shingles vaccines as long as the patient is over 5 years of age, which we're recommending that these vaccines be used on label. So it would be for the indication of adults 50 years and above. There are 2 shingles vaccines available in the Canadian market. They are Schedule 1 according to NAPRA, and so they do require a prescription. Now, this can be obtained in a number of ways. The patient might come in with a prescription from a nurse practitioner or a physician. You might also fax the prescriber in order to obtain one, similar to performing a pharmaceutical opinion for patients in Ontario. Or you might even have a relationship with a prescriber and set up a medical directive. And if you do end up setting up a medical directive with a prescriber, let us know, because we do have templates that you can leverage for this. Now, the 2 vaccines that are available are Shingrix, which is a non-live recombinant adjuvanted vaccine, and Zostavax 2, which is a live attenuated adjuvanted vaccine. So some things that are really important to point out is really highlighting that Zostavax 2 is a live vaccine. And so this vaccine should not be given to people who are immunocompromised. Shingrix, which is a non-live vaccine, should be used in patients who are immunocompromised. And there is data to support the safety and immunogenicity in various patient populations who are immunocompromised. So again, feel free to reach out to myself via email, and I can forward you the specific trials.
Right, and if you're a newer practitioner, you might not know, but Zostavax came out on the market first, and Shingrix is a subsequent entry more recently, the last couple of years.
And one last thing to note is that Zostavax 2 does have public coverage in Ontario, not in Alberta, and only for patients who are 65 to 70 years old. So patients might ask you about that, and it's good to be informed. We'll talk now about the comparative efficacy. And this can help in terms of recommending one where even though a cost might be associated with the vaccine, it might be worth it given the additional efficacy both in preventing herpes zoster virus or shingles, as well as postherpetic neuralgia. So you can see here in the orange bar graph, that's the Shingrix vaccine efficacy. And we can see that along the different age groups, the 50 to 59 years, the 60 to 69 years, and the 70 years and plus, the vaccine efficacy remains above 90%. And we know in the studies, Zoe 50 and Zoe 70, that efficacy remained for the duration of those studies follow-up, so at least to 4 years. And it's currently being evaluated to see how long this lasts for. so far, based on immunogenicity, it doesn't look that even 10 years out, immunogenicity is waning. It seems to be stable, but we're waiting for additional evidence in terms of real-world efficacy. In contrast, when you look at Zostavax 2, which is the vaccine that's publicly covered for certain age groups, we actually do see diminishing efficacy and inferior efficacy, although head-to-head trials haven't been conducted. So in the 50 to 59-year-olds, instead of almost 97% efficacy that we see with Shingrix, Zostavax has about 72.4% efficacy. And as we move to older and older patients, the efficacy reduces and reduces. So in patients who are 70 years and above, efficacy is only 37.6% compared to over 90% with Shingrix. One of the things that a lot of patients ask actually is, how long do I have to wait after getting my Zostavax vaccine to get a Shingrix vaccine? And so if the patients did get Zostavax through the publicly covered program, the recommended amount of time to wait from NACI is 1 year. In terms of how long do patients have to wait after they've actually had shingles, the recommended amount of time from NACI is also 1 year. And the reason for that waiting is that when patients actually have shingles, it boosts their immune system and response. And so we want to leverage that year where they're probably having a response anyways, but then we want to make sure to immunize them so that they don't get shingles again.
Right, so if you have a patient who has shingles now and you're dispensing medications to treat that, you might want to schedule a reminder for yourself to bring them up in a year and advise them it's time for their vaccine.
So in terms of vaccine administration, we've highlighted the Shingrix administration here. The reason being that Zostavax 2 is administered as a single dose. And so once that one dose is administered, no additional doses would be required unless you wanted to immunize them against shingles with Shingrix. For Shingrix, because it is a 2-dose regimen, you administer the first dose and then 2 to 6 months later, administer that second dose. So for anyone that you immunize during the shingles campaign this February, it's great to follow up with them this April to September to make sure they do receive that second dose.
So Tiana, in your slides, we have here a good discussion about the 2 vaccines and the efficacy of them both, the schedule of them both. So if a patient walks into the counter, they're 50 years old, and they haven't had either, what's the recommendation?
Well, NACI recommends that the Shingrix vaccine of choice in Canada is Shingrix, and that is for efficacy reasons.
Yeah, so I didn't want someone listening in to think, okay, we give them Zostavax first, and we wait a year, and now we give them Shingrix. So the recommendation is just skip Zostavax if they haven't received it and start with Shingrix.
Exactly. Now, if unfortunately a patient hasn't been immunized or they do happen to still get shingles, there are treatment options available. In terms of the mainstay for addressing shingles, the mainstay would be antivirals. So the first-line therapies are valacyclovir and famciclovir. And the reason for that is that they can reduce the acute pain related with shingles, as well as reducing the duration of postherpetic neuralgia. In contrast, acyclovir only reduces pain, not the postherpetic neuralgia. And on top of that, while valacyclovir and famciclovir are taken 3 times a day for 7 days, acyclovir is actually taken 5 times a day for 7 days, so adherence can be an issue.
Right, so in most cases, we want to avoid the acyclovir unless there was some other patient factor that led us there, maybe price, but otherwise it's a third choice.
Exactly. And if you wanted to learn more about dosing schedule and coverage, both in Alberta, Ontario, and through NIHB, do check out our Therapeutic Thursday, which will be coming out later this month, about treatment. The other thing that I want to point out is treating acute pain. So patients who have shingles will likely have pain. Some over-the-counter medication options are acetaminophen and NSAIDs that you can recommend to them, or referring if the pain gets too severe and they require a prescription option. And then for postherpetic neuralgia, which is more the chronic pain, so things lasting 3 months or longer, there are options like gabapentinoids or tricycline antidepressants. I also wanted to point out who to refer to a prescriber. So oftentimes patients might come to you with a prescription for antivirals. If they don't, but they're coming to you more because they've noticed a rash or they want something to cover it, you should refer them so they can get therapy for the antivirals. Antivirals are recommended for all patients over 50. It is recommended to treat them for shingles rather than to strictly let it run its course because of that danger associated with postherpetic neuralgia. If you find a patient has come in and they've received a prescription for antivirals, but now the shingles has spread, and so it's covering multiple dermatomes, or it's now has ocular involvement, that's a time to refer back to the prescriber so that they can assess if IV antivirals is appropriate. Similarly, patients who are immune compromised, especially patients who are HIV positive, should be referred back for IV antivirals. Okay, so now we'll talk about the pharmacy immunization workflow, and it'll work differently in everyone's pharmacy, but we did want to point out some key steps to consider. So the first step is actually to register in the vaccine clinic database so that patients can find your pharmacy as a pharmacy who can administer shingles vaccines. And we'll talk about that further in the next slide. The next thing that you can do to proactively identify eligible patients is to run reports of your dispensing software, so Kroll or Philware, and we'll go through that in detail in our appendix. The next thing to do is screen these patients, as well as any patient that comes in, to see if they're over 50 years old and they'd be eligible for a shingles vaccine. A great way to identify potentially eligible patients and to really optimize immunization and protection is to see patients who are receiving immunizations for another adult vaccine preventable condition and to immunize them against both on the same day. So if you see someone coming in for a pneumonia vaccine or a meningitis vaccine, this might be an appropriate time to also give them Shingrix.
What about flu vaccine, Tiana?
Oh, that's the biggest one. I forgot that. So as you may have noticed in our consent forms this year, there was a section where patients could self-identify as being eligible for vaccines when they were being screened for their flu shot. So anytime a patient is coming in for a flu shot, because you already know they have buy-in at least to some extent about the benefits of vaccines, it's great to start that conversation about optimizing other vaccines as well.
Yeah, it's a really good point. Often I find those flu patients may not be my regular patients. So it's a really great opportunity to differentiate your pharmacy and get that business while protecting the patient.
Yeah. The next thing you want to do, especially with shingles vaccines, because they are Schedule 1, is to obtain a prescription and then to administer the vaccine and inform the prescriber. It helps build that rapport with the prescriber and also shows them that you're available to help with this and the value you can bring to their patients if they refer additional people to you for care.
It's actually required in some jurisdictions to notify the primary care provider. So for example, Ontario, if you give a shingles vaccine, you're required to notify.
And you can check out on the partners portal, we do have a prescriber notification form, and you can leverage that to help integrate it into the workflow a bit easier or a bit faster too. The last thing would be to follow up both after the vaccine as well as when it's time for the second dose, so in 2 to 6 months, in order to make sure the patient completes their full course of immunization.
Yeah, that's very important because, I mean, patients may forget. So when you're giving that first dose for the Shingrix, that's a good chance to schedule the second dose. And so my practice would be 2 months from now. I already arrange when that patient's coming back, and then schedule the refill reminder and also a follow-up call to remind them to come and have that vaccine administered.
Yeah, and you can remind them of that even when you do your follow-up after administering the vaccine, maybe in 2 to 3 days. This can also be a time when you can address any side effects related to the vaccine. So we do know that with Shingrix, there have been higher reports of both injection site pain and swelling and inflammation, as well as more general side effects like malaise or feeling unwell. It's good to talk to the patients and let them know that this is a possibility before they receive their vaccine. So they can schedule it, for example, on a Friday, so they feel back ready to go to work on Monday. Generally, these side effects last about 2 to 3 days, and they tend to be worse with the first vaccine. So that can be a bit comforting when you talk to them about their second dose, that if they didn't experience anything the first time, they probably won't experience anything the second time. And if they did experience something the first time, it probably won't be as severe the second dose.
Yeah, that's a really important conversation. Scheduling that vaccine when they don't have a lot of things to do the next couple of days for the first dose. It is kind of hit and miss. Like some patients, it doesn't bother them, but other patients, they do feel the side effects. And as Tiana said, usually the second dose is much better tolerated. So hopefully they don't get deterred by the first. If they're complaining of the side effects, have that conversation that next time should be better.
Okay, and so here's the vaccine clinic database. So what I found actually is that a lot of third-party vaccine websites that drug manufacturers have partnered to develop actually let the user type in their postal code, and that reroutes them to Vaccines 411, where they can find the nearest vaccine clinic. So when I did this search myself, I found that I couldn't actually locate many whole health pharmacies. So one way to attract new patients and to advertise the fact that you are able to help protect patients against vaccine preventable diseases is to register on this website. So I've included the link below. If you go to vaccines411.ca/en/add-clinic, it'll give you the option to add your clinic, and you can specify which vaccines you provide. So you can click vaccines for adults 50 plus, and then select things like shingles, meningitis, pneumonia, and any others that you do. So things like HPV or travel vaccines, and get yourself added into this database. Then patients who search will be able to find you, even though they may not be a regular patient.
And that's very interesting for me, Tiana, because I didn't know this was out there, but you did show me how different advertising from pharma is going to be directing patients to this list. So it's something you'll want to add your pharmacy onto.
Yeah, and then once you complete a fairly straightforward questionnaire, someone will contact you from 411 Vaccines just to authenticate this and then get you added onto the repertoire. So I'll now touch briefly on our shingles campaign. So you should all have received your shingles campaign materials in the mail the first week of February. If you require any additional materials or have any questions, feel free to email me at tiana@wholehealthrx.ca. You can also access materials on the Partners portal, and you can download them in print or download and share through social media. We have the shingles webinar, which you're now listening to, as well as adult immunization posters, which have been sent out with your new store kits or with past immunization campaigns. In order to obtain prescriptions, we do have templates like pharmaceutical opinions or medical directive templates that you can leverage, and feel free to email me if you need those. Lastly, GSK has provided patient brochures, both in English, Chinese, and Punjabi. So we've mailed those out according to your demographics, but let us know if there's another demographic we've missed. There's also social media content. So there are 7 posts that you can share across Facebook, Twitter, Instagram, using the hashtag Stop Shingles and tagging at Whole Health PP so we can see it. And then in pharmacy materials to get that conversation going with patients. So the buttons, countertop displays, prescription bag attachments, and counseling guides. Those are for both the pharmacist and the pharmacy assistant and technicians. Now, one of the fun parts of these campaigns are also the participation contests. So if you take pictures and send them in to me by Friday, February 14th, and we may even extend that to the Friday, February 21st, you will receive a Tim Hortons breakfast for your entire pharmacy team. So it's very easy to take those 5 pictures and send them in. Let me know if you have any questions. And new for this shingles campaign, we're trying a new thing where you can send a 1-minute video of yourself talking about either adult immunizations or shingles. And this can be through role play or pretending to be talking to a patient. And you can touch on topics like the benefits of adult immunization, why we make shingles vaccine recommendations, or how to address vaccine hesitancy, or anything that you'd like, and email the video to myself, and you can receive a $20 Amazon gift card. And this is an individual contest, so everybody from your pharmacy who'd like to enter can. And it's important to note that it's not just for pharmacists, it's also for pharmacy assistants and technicians. And if you want any potential counseling points, feel free to read the counseling guide and pull tips from there.
Well, we're going to shift gears. So the first half of this presentation was about the program and about clinical aspects of shingles and vaccination. The last little bit, we're going to show you how to pull some reports from Philware or from Kroll to help you identify patients who may be eligible for the vaccine. So we're going to begin with reports by age. So as Tiana explained, patients who would benefit from shingles, where shingles vaccine is indicated, are those 50 years and over. So there are ways to pull reports in both Philware and Kroll. So we're going to start with Philware. So to get the report for patient age, we start in the bottom corner there with menu. So you click menu, and then you have to select reporting and then reports. And these steps are the same for the 2 types of reports we'll show you in Philware. So menu, reporting, and then reports. So if we select active patient list, you can put the age group you're interested in selecting. So for shingles, we're looking for those 50 years and over. So we did to 110, so 50 to 110. So this report is going to pull all the patients in our database that are within that age group. You should also be mindful of the dates. So the dates is in the top corner there. So I would, if you're a greenfield store, put the date you open so you'll get your whole database. If you're an older established pharmacy, maybe you want to go back 5 years or more, depending on how busy your store is and how concise a list. If you have a very busy practice, maybe just the last couple of years, just so you're not overwhelmed with data at the beginning. And then you can hit preview to see your report. Your report won't look quite like that, but you can have the option to either print it or export it. And when you export it, you should get an Excel file, which you could work off of, or you could just print it and go by the list by hand. So that's how you get the patient list in Philware. For those of you using Kroll, similar process. So you go reports, patient listing report. And then we're going to go to tab number 2, where we can enter the ages of patients. So again, we selected between 50 years and 110, and we're choosing active patients. And at that point, you can either hit preview, print it, or save it as CSV will give you the Excel file. So I will always preview before I would print just to make sure you're getting what you wanted and it's not 1,000 pages. So yeah, it's a pretty simple report to generate. So there you have it. So there's an example of a report on the right-hand side. It won't be exactly that report, but similar idea.
And one of the things you can do to help integrate this into practice is to have technicians, for example, actually run this report, or even students, pharmacy students, showing them how to leverage data to optimize vaccine uptake. That's an excellent opportunity. And you can give them these slides so they can go step by step. You can also email us if anything's unclear, and we can walk them through remotely as well. And then the pharmacy student or technician or assistant can actually go down the list one by one and call these patients after they've checked their profile to see, okay, have we dispensed any vaccines for them? They can do the calling and document in the Excel what day they were called and what day they want to come in for their appointment.
Yeah, as Tiana said, it's important somebody audit the list so we're not just calling everybody. So if you filled a one-off prescription for this person a couple of years ago, probably it's not worthwhile trying to get them to have the vaccine. But if they're one of your regular patients, it really is within your scope to take care of them and make sure their vaccines are up to date. So if you notice, maybe I would start on the list with patients you're comfortable with and familiar with and get them vaccinated first before you expand more broadly. Because once you get a few patients saying yes, it helps to build that confidence to go further with the process. So Tiana had been brainstorming what kind of medications might signal that you may be interested in more vaccinations. So we have pulling reports by medication, in particular vaccines like pneumonia vaccines, or if they already received the Zostavax vaccine and now it's time to update their record with shingles. So with the Shingrix vaccine. So I'm going to show you how to pull those reports.
And you can actually even run the report for patients who've received Shingrix, because we know that oftentimes they don't receive that second dose. So pulling that report can make sure that people do get that full course of therapy.
Yeah, that's a good point. And even if they had Shingrix, what happens now? They're 9 months out. What's the recommendation? Do you know? So the recommendation is they should get the vaccine. So it's okay to extend the window. It's better to get it. They don't have to restart. Get their second dose, whether they've been delayed. Even if it's more than a year later, they can still get the second dose. They can complete the series. So the first steps when Philware for generating this report is the same as the last step. So menu, reporting, reports. And then we select drug usage details down the bottom. And remember to select the date range there on the top left. So if you don't change that to cover a period of time, you're not going to get much of a report. If you have a very narrow dates, you're going to look at very narrow prescription database. And then once you have the dates, you start check filter by, and you type in, you can either type a DIN or a drug name and start the search. Once you add in the drug names, you check the boxes, and then you select check drugs. And then you hit preview. And it will get you this list. Andrew is one of our pharmacists, and he gave us permission to use this database he generated for us from his Philware. So these are not actual prescriptions Andrew received. He just made them for our webinar. And we click export. You can either export or you could print it. So you would add onto that list there on the left-hand side any of you were interested in, to Pneumovax or Zostavax, even put in the anti, and I would do a year or more ago and kind of screen if those were likely shingles prescriptions, something else you could look at. And similarly with Kroll, so this is a nice report you can get from Kroll. So you have reports, RX, RX for drug doctor groups. And again, on the first tab, we need to be careful with selecting the dates we're interested in. It's important under the doctor tab that it's blank. So in my own pharmacy, other times I would have had a doctor there if I was searching for a particular doctor's prescribing. So you need to make sure you clear out the doctor list. Under options, you can toy with this a little bit and generate a report to your liking, but we suggest you do the grouping by patient rather than drug so that you're not addressing the patient multiple times. Rather, you'll see them once with the drugs they receive listed together. And yeah, you can select some different details. Like if you do unfills, you might see they dropped a prescription for a vaccine but never filled it. So maybe you'll find Prevnar, why didn't they fill the Prevnar? And that's something you could follow up on. Perhaps now they have better insurance or they saved up for it and now they'll get the vaccine. So you need to go to the drug tab here and you click add and then you type in the search box there. So you could type Pneumovax and you search and then you select. And then once you hit select, it adds it to that list. So if you went into have multiple vaccines, you just click add again and go through that loop until you have everything you wanted. And then you hit preview and you can either print it or you can save it. Again, I would hit preview just to see what you're getting before you print it. And you receive a report that looks something like this here on the right. So again, once you have that list, it's something to support your vaccine program in the pharmacy. Gives you, a good starting point for patients who might be interested in the shingles vaccine, but perhaps haven't received Shingrix.
Yeah, and learning to use data to optimize vaccine uptake, that can be used for any adult vaccine. So similar to how we set an age range for shingles, in the case of shingles, we wanted 50 years and above. For things like meningitis, you could set it to 15 to 25 to get that high-risk patient population. For pneumonia, you could do specifically 65 and above, or you could do 50 years old and above, and then also run a report on medications to see who's at high risk because of comorbidities. The options are really endless, but we'll start with that and let us know if you have any questions.
Yeah, if your database does go back a few years, I would just start with the Zostavax because that was an easy win in my pharmacy. We had a report with maybe 40 or 50 people who received Zostavax. Well, now we have something that's more effective, and most of those patients were eligible. So it really shows the care that your pharmacy provides if you're being proactive with their health and reaching out and collaborating with their doctor and bringing it all together to get that vaccine done. So it's really a great service you can do.
So with that, we will leave you. Thank you so much for tuning in and for watching the webinar, as well as for participating in the Shingles program. I know we've already received quite a few participation contest submissions. So thank you so much for that. And thank you for protecting your adult patients from vaccine preventable diseases.
Thank you, everybody. Take care.